This is Elysium's Potters Bar clinic. It cares for some of our most vulnerable adults and children. Its website has a video tour and says it provides a warm, nurturing environment. But in an inspection in February this year, the regulator said instead safety on the children's ward was not a priority. Now, BBC London can reveal first-hand accounts of some of those admitted then.
Former patients have told us how staff here would routinely fall asleep while on duty when they were supposed to be watching them to prevent them from self-harming, and that when staff were awake and still on observational duty, the patients were still able to try and kill themselves.
Here's a photo of a member of staff who appears to be asleep while on duty. Rather than being alert and awake, making sure a patient doesn't harm themselves, she has her eyes closed and cradles her head.
Stuff there was so scary. Made you feel a lot worse. I felt really, really low. There's no way out of how bad I felt.
These are the words of one patient, voiced by an actor. We're not naming her as she is young and vulnerable. She's now been discharged and volunteers at a local community project caring for animals. She was 16 years old when she was admitted last year. She was suicidal at the time, and despite a clear NHS regime for keeping patients on observation, she says staff would routinely sleep instead.
Staff would take their chair into your room so the cameras couldn't see. I woke them up and said, "There's someone's life that you're putting at risk." They said sorry, but that's it. They all went back to sleep.
One of her most painful memories was when she tried to kill herself. She was on one-to-one observation at the time.
It took them a while. I just wasn't paying attention. One-to-one isn't help. It's pointless. Half the time, they're not even watching you.
And it seems the problems aren't just limited to the children's unit. An adult patient who's gay with a diagnosed personality disorder has told us how a member of staff would tell her that the voices in her head were because she was homosexual.
That she was possessed by the devil, and that a staff member sat by her bed praying over her, touching her head and asking evil spirits to arise.
She also says that as a diabetic and whilst on one-to-one observation, she was given enough insulin to overdose, going back to her room alone and repeatedly injecting herself. She ended up being hospitalised.
So what level of care should we expect in secure psychiatric units? We asked a leading expert on the danger of sleeping while observing patients.
Could it be life-threatening?
It could potentially be life-threatening if you are observing a patient to prevent them harming themselves, and if that's the purpose of the close observations and you're sleeping, you're obviously not able to observe them, so that would be a significant concern.
In response to these allegations, Elysium Healthcare sent us a statement in which they said,
"We are deeply sorry that two former patients feel we failed to provide the level of care they would have wished to receive. The safety and well-being of our patients is always our number one priority. We have a zero-tolerance policy to any behaviours or use of language which may cause a patient to feel vulnerable. We have also been successful in recruiting more staff and specialist clinical managers, and the Care Quality Commission recognises that we have made significant progress in their most recent report."
As for the regulator, a follow-up inspection earlier this year said care was improving and lifted 7 of 8 conditions that had been imposed on the children's unit. It does still mean, though, that there can be no new child admissions without prior approval from the CQC. For those who we've spoken to who had experienced Elysium's care firsthand, it was meant to guarantee their safety. Instead, it made them feel uniquely unsafe and at risk. Alex Bushell, BBC London.